Hello, everyone. Good afternoon. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They seem like freckle, like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across 4 Indian cities, it reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation, generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hassles and to keep you informed, today we are here to know about sunscreen and melasma from an expert. So let's connect today with our skin expert, Dr. Gillian Roga, live from Chikkamagaluru, to talk on sunscreen, an integral part in treatment of melasma and hyperpigmentation. Dr. Gillian Roga has completed her MD and DNB specialization in dermatology at one of the most prestigious institutes of the country, St. John's Medical College, Bangalore. She also completed her fellowship in hair transplant at Derma Clinics, New Delhi, a pioneer institute in advanced FUE method of hair transplantation. She has also been invited as one of the few Indian faculty to deliver a lecture at the 16th World Dermatology and Laser Conference held at Dubai in 2016. She's regularly invited as a speaker in various national and international conferences. She has many articles published in national and international journals as well. Dr. Gillian is currently practicing at a clinic in Chikkamagaluru, as well as she also visits Hassan, where she is committed to provide world-class care with high ethical standards in the field of skin, hair, cosmetic surgery, lasers, and hair transplant. It's such a pleasure to have you with us, Dr. Gillian. Welcome.
Thank you so much for that lovely and kind introduction. And it's great to be here.
It's a pleasure for us as well, Doctor. And now, Doctor, as today we are going to talk about sunscreen as an integral part of our, skincare routine in focus of melasma or hyperpigmentation. First of all, we would like to understand, Doctor, what is melasma?
Okay. So melasma is actually a type. It's a kind of hyperpigmentation, which means in melasma, which is generally more common in women, although we do see melasma in men too. But what we generally see on the skin, what patients generally present with is bilaterally symmetrical, dark brown to light brown patches. Now, what does that mean? Bilaterally means generally we see it on both sides. Most of the time, it might be on the nose, bridge of the nose, on the cheeks. Sometimes it might progress even onto the forehead or onto the upper lips or around the mouth. Symmetrical means that most of the time it might be seen on both sides. For example, if it's seen on one cheek, it will also be seen on the other cheek. And the color of the melasma might range from light brown to dark brown. In certain cases, depending on how deep the pigmentation of the melasma is. If it's a little deeper in the skin, it might even look a little, grayish or darker than, the normal shade that we see. And so, as I said, it's a type of pigmentation, which means since the discussion today, our topic of discussion is melasma and hyperpigmentation. So it's important to understand that pigmentation is a very common, a very generalized term. As the name suggests, hyper means more and pigment means more color. So the term hyperpigmentation itself means that there's more color in the skin. But melasma particularly means, in this particular distribution, like the cheeks and the nose and, those kind of things.
Right. So we can say in a way that melasma is a part of or a kind of hyperpigmentation. So hyperpigmentation is a broader concept, right?
Absolutely. So it's like melasma is a kind of pigmentation. And,
Right.
not all pigmentary disorders are melasma because there are so many other kinds of pigmentation. So yes, melasma is a type of pigmentation. And then there are other types of hyperpigmentation disorders also.
Okay, fair enough. And doctor, what causes this melasma?
Okay, so there are many causes for melasma actually. So one of the most commonest causes are UV light. So by UV light, we mean UVA, UVB. And nowadays, another important kind of radiation or light that also triggers melasma is also blue light and infrared radiation. So infrared is something that most people are exposed to, especially women when they are at home or in the kitchen, typically, especially Indian women who are next to the stove or spend a lot of time in the day in the kitchen or next to devices that produce a lot of heat. So that is infrared. And when we talk about blue light, so a lot of people who are in the IT sector or people, or, software engineers or people who work online. So those who use laptops, computers, mobiles, smartphones, smart devices, all these things. So that also exposes you to blue light and visible light. So that is one of the causes for melasma. Then the other cause of melasma is also hormonal conditions. For example, a lot of women, sometimes, especially in women. So the hormonal factor is more common in women, as we were talking about. So irregular cycles or any hormonal disorder, even sometimes if there's a hormonal variation, for example, pregnancy is a common situation or a common scenario in women when there is a hormonal surge or a change in the female hormones.
Right.
Also, menopausal women. So even around menopause, there will be certain hormonal changes. So that is another factor. The third factor could be a family history or genetics. So a lot of young girls or young women, they come to us saying that my mother or my grandmother had melasma, or she has pigmentation, so I'm worried that I'm going to get this. Yes, genetics do play an important role. Then there are also certain medications like OCPs or oral contraceptive pills and certain medications that can also predispose us to melasma. So, yeah, these are some of the common factors and the common causes of melasma.
Right. So there can be a number of causes responsible for melasma.
Absolutely.
And as you said, doctor, that, the harmful rays, either from sun or from the devices that we are working in front of, or even the gas stoves, LED lights. So even if one is working from home, or somebody is going under the sun, or somebody is just a housewife working mostly in the kitchen, we all are exposed, to these radiations, and that's damaging to our skin. How to prevent it, doctor?
Yeah, so that's a very valid and a very good question, because as you mentioned rightly, right, there are always these three scenarios. So
Right.
one are people who spend a lot of time outdoors. So our instructions for those kind of patients are a bit different. The second group of people are those who are, working online or working in offices or working from home, especially, in the last couple of years, a lot of people have been working from home on their laptop devices. So that's the second group. And then comes the third group, as you mentioned, that is women, housewives or women or ladies who are just at home. So
Right.
suppose the first scenario, which you spoke about, someone who is spending time outdoors, someone who spends a lot of, like, people who travel or, are
Who
out.
work in the field, or engineers, or even athletes or sports persons, because their exposure under the sun is huge.
It's huge, absolutely. So for those kind of people, our recommendation, of course, is, use a good sunscreen. And the kind of sunscreen that we need to recommend to them is obviously going to be a little different from people who are spending most of their time on a laptop or a computer. Other than that, people who do spend a lot of time outdoors, other than recommending a good sunscreen, we also tell them to use physical protection. By physical protection, we mean like a broad brimmed hat. So, just a normal cap might not give you that kind of protection, but a broad brimmed hat means it'll give you 360 degrees protection. Or we also tell them to, use if it's a lady or someone who's not comfortable with using a hat or something, we could also tell them to use an umbrella or a scarf or, some sort of physical coverage, like, just using a normal shawl or a dupatta with broad, huge, large glasses, all those things kind of additionally give you physical protection. So it's protection in the form of your sunscreen as well as your physical protection, versus someone who would be just indoors all the time, sitting on their computer or working from home. For them, just giving them a good sunscreen, which has that added protection, not just of UVA, but UVA, UVB, it should also give them protection against, blue light and visible light. And then the third scenario is a housewife or a lady who is in the kitchen or at home. So for them, again, we don't need physical protection, but definitely we also need a broad spectrum sunscreen, which does give them protection against infrared light. So, broadly speaking, those would be the key differences in these kind of.
Right. But sunscreen is something that we all need, and we need to use it religiously. We'll talk about it, later. But before that, are there any symptoms associated with the melasma, or is just the signs, the freckles or the patches that tells us that, okay, it's happening?
Yes. So, generally melasma is asymptomatic. So the word asymptomatic means it doesn't have any symptoms, it doesn't have any itching or anything. But as you said, there are signs. Yes, there are key signs. For example, initially, like for some patients, they're very observant, especially with women. They always keep observing their skin or their face every day in the morning when they get up and look at themselves in the mirror. So some ladies who kind of pick up these subtle signs, they might start seeing little freckles or a little darkening on the skin, which might not be too obvious, but they start seeing that little a shadowing kind of effect on the skin where they start noticing certain patches. So generally, if you say symptoms, we would say it's asymptomatic most of the time, but signs are there. What are the signs? So generally you might start seeing little dots or patches which start most of the time on the bridge of the nose, on the cheeks, and then it gradually spreads on the rest of the face. So those would be the symptoms. And the color might be light brown to dark brown. Rarely, it could be little grayish or blackish also.
Right. Now, when we were discussing the causes, you said that pregnant women, because there is surge of hormones, change of hormones, so they are prone to pigmentation. Risk factor is there. Pregnancy is a risk factor. What are the other risk factors, doctor, for melasma?
Yeah, so the other risk factors, as we were discussing, other than pregnancy, also certain medications can cause melasma. Also, a family history. For example, in a lot of women, they have like their parents, aunts, mother, grandmothers, everyone. So that would definitely be a risk factor. Also, being outdoors, your profession, your job, using a lot of laptop or continuously being in the kitchen or spending a lot of time outdoors, not using a sunscreen, not using a proper skincare routine, those could also be risk factors. And then, of course, there's the age factor also. So, most of the time, melasma we don't see it in younger patients. We see it in people who are, between 25 to 30. Very rarely, yes, it can start a little earlier. But that's also a risk factor. So the age factor, the job, your profession, your skincare routine, pregnancy, even other hormonal changes. For example, there are so many hormonal disorders, for example, thyroid disorders, or any other hormonal factor. Or if there's a bit of a regular, an irregular menstrual cycle, all these things could be risk factors for melasma.
Fair enough. And doctor, as a doctor, how do you diagnose melasma? Just by the physical investigation, or there are other tests, etc.?
Yeah, so the key factor, of course, is the clinical diagnosis. By that we mean, like, just by examining the patient and looking for those signs. And nowadays, since there's been so much of advancement in dermatology, you also have other tools. For example, you have something called as dermoscopy, which is like a handheld microscope device where, if we, take a very close look, especially in the initial stages, we can look at those subtle signs. There are some signs, I don't want to go into too much of detail because that's a lot of dermatology. But yes, dermatoscopy is a great tool to pick up melasma and also to figure out what kind of melasma. Is it epidermal, dermal, what stage, or even in the initial signs. So in the initial stages, so that is a new technology that we do use to diagnose early melasma.
Okay. And what are the treatment options available for melasma, doctor?
So I always tell patients, prevention is better than cure. So the first thing is to prevent it so that we don't have the problem and then we don't need to treat it.
Right.
So I think sunscreen is the first thing, which I mean, sunscreen is something which, it's not just treatment of melasma. It's everything. I mean, nowadays it's part of your skincare routine. And I think nowadays, there's that much of awareness that each and every person, nowadays, even kids, even they know, they are aware that, they do need to use a sunscreen. So I mean, in this generation, I feel sunscreen is something which everyone does. So that is, of course, that goes without saying. So the first step is the sunscreen. Other than sunscreen, yes, then when we come to the treatment, once the patient already has melasma, then what do we do about it? So yes, of course, the first thing is depending on the severity of the melasma. By that we mean, how severe? Is it a single patch? Is it just on the cheeks? Has it spread to the rest of the face? So our treatment would depend on how severe it is, how much it has progressed, and also what kind of melasma. So as I was mentioning, there are two types of melasma. One is epidermal. Epidermal means the top layer of the skin, and dermal means the deeper down layers. So there are a lot of treatments that work just for the superficial epidermal kind of melasma. Like a lot of creams are available in the market. And then there is dermal melasma, which is a little deep down. Over there, just using creams and topicals and skincare routine might not be sufficient. We might need to do some treatments and those kind of things. But broadly speaking, since you had mentioned what are the kind of treatments, yes, there are creams containing retinols, there is alpha arbutin, lots of skin products that can be used which depigment those patches of melasma. Then there is vitamin C. There are so many antioxidants nowadays. So all of those, silymarin. Nowadays, a lot of newer ingredients are available: kojic acid, glycolic acid. All these molecules can be used successfully to lighten and to control the melasma.
Right. But I'm sure you also get a lot of patients who had already done some, home remedies, tried some home remedies, or gone for over-the-counter medication, or facials, claiming that they'll help get rid of their pigmentary issues, or take suggestions from their friend or a relative who had gone through the same phase. Now, in all these, we actually spend or waste a lot of time, energy, money, and of course, the condition of our skin also worsens. So there are two questions basically related to this, Dr. A. Is it okay to go for home remedies or over-the-counter medication, etc.? Or if we go for these, how difficult our treatment will become when we finally land up in front of doctor?
Yeah. So to answer your first question, that is it okay to go for home remedies? So that, it entirely depends on what home remedy the patient or the person is following. So what we mean by that is, see, nowadays we see so many people applying different kinds of things. Now, some things are okay, which means by okay, I mean to say it doesn't have any side effects. It might not do much for the skin. It might not, of course, help much or treat the melasma, but it doesn't cause any side effects. So to those kind of home remedies, we would say it's okay. For example, a lot of people put, just curd or something, and, just aloe vera and those kind of things, or rose water. Those are things which don't really cause much damage. So in certain patients, again, not all patients can use that, because as I said, curd is lactic acid. So, it has a small quantity of lactic acid, but what is the quantity, the amount, it's very difficult to determine those things. So yes, even simple things can cause problems sometimes. So we have to be very careful with those things. In certain people, it doesn't cause a problem, but in certain people, it does cause a problem. And then there are some things which cause a lot of irritation. For example, some people rub lemon and toothpaste and all sorts of things, and scrubs, and use homemade scrubs and all those things. So lemon, of course, is citric acid, which we definitely would suggest to the patients not to apply, because that can cause a chemical burn and cause more hyperpigmentation. So we need to be very careful about home remedies. So that is my answer to that. And coming to the
Right.
second question, which is B, what happens after that? So like we get a lot of, especially being dermatologists, we get a lot, most of the patients we see are at the spectrum of, having, I mean, most of the time we end up treating patients who develop these side effects, or who've already, experimented with their skin, either their friend or someone in the parlor or some relative or someone has suggested something on, social media. They've seen some blogger and someone said, mix this and turmeric and lemon and something. And, and most of the time, after that, once the patient develops a side effect because of all these things, it gets even more difficult to treat the problem, number one. And number two, the regular treatment, which works for most of the other patients, those patients might not see that kind of good result because the top layer of the skin, the epidermal barrier, the skin has already been compromised. Then the effort that the patient has to put in and the amount of treatment that that particular case needs is more. So it's more difficult. So I would say, I always tell patients, be kind to your skin, be good to your skin, because your skin is going to represent you for the longest time. That's like the best makeup you can have on your skin is having healthy skin. So if you're good to your
Absolutely.
skin, yeah, if you're good to your skin will be good to you.
Completely second that, and that's the mission we have. That's why we are conducting this session, so that we can spread awareness that how and why it's so important to go and consult the right person, which is a dermatologist, a qualified dermatologist in this case. So please don't experiment with your skin. Please don't do trials and errors and experiments. Go to an expert, which is a qualified dermatologist. Rohit John is here. His question is, how many types of melasma are there?
Yeah.
You were also discussing, so we would like you to shed some more light on that.
Absolutely, Rohit. So that's a very good question and a very valid question, because I think it's important to know about the kinds of melasma. So there are three types of melasma. One is epidermal, which is the superficial kind of melasma. The second is the dermal, what I was mentioning, which is deep down. And the third is mixed. Mixed means it's both a combination of epidermal and dermal. That is one way of classifying melasma. Then there is another way of talking about melasma, depending on the area of melasma. For example, if it's just on the malar area, this cheek area, these cheekbones, that's called as the malar area. So sometimes if the melasma is just there, that is called as malar melasma. Then you can have something called as centrofacial melasma. Centro, as the word center means, it's in the center of the face. So when the melasma is there, that's called as centrofacial. Then you have something called as mandibular melasma. Mandibular means this jaw, this bone here. This is called as a mandible. So some patients have like mandibular melasma. So melasma can be, there are different types depending on the area and depending on the location where it is in the skin. That is the depth and the area. So that's how you have different types of melasma.
Right. And you get it gradually, it grows gradually, right? So that's why it's important to understand that, okay, I'm having this melasma, I can see some patches, etc., and we can go and consult a dermatologist. We have Lovely Singh with us. Her question is, I'm diabetic and have thyroid for last 10 years. Shall I take some preventive measures to prevent melasma?
Hi, Lovely. So yes, I think it's really important because as I was mentioning that yes, hormones can definitely, that is a risk factor for melasma. And since you're saying you have thyroid and there's diabetes, definitely the first thing anyone should do, especially for someone with hormonal issues, is to start using a sunscreen, right? So I would definitely suggest you, if you're just looking for prevention and precaution and you don't yet have melasma, definitely the first thing you can do and the simplest thing you can do is to start using a sunscreen.
Right. So I think the bottom line is that we all should start using sunscreen. It will not only prevent us from melasma or pigmentary disorders, it will also prevent so many other things like sunburns, and it also works as an anti-aging, right, doctor?
Absolutely. Yeah. And all women, all men nowadays, everyone wants to look younger. No one at
Exactly.
40, no one at 40 wants to look 40. Everyone wants to look like in their 30s or 35. So that's what I tell you.
True, true.
I tell people, if you want to look younger, if you don't want to age, start using your sunscreen. That's the first thing you need to do.
Right. Now, talking about sunscreen, whenever we go out buying a sunscreen, A, there are so many sunscreens, right? B, there are medicated sunscreen and the cosmetic ones. Then there are so many informations written on the box, including the SPF factor and so many other things. What are the basics to look for when we are buying a sunscreen for us, doctor?
Okay. So when it comes to, like, let's keep it very simple. Okay. I generally tell patients just to keep three things in mind. Number one, what kind of sunscreen it is. Is it a lotion? Is it a gel? Is it a matte based sunscreen? Is it a cream based sunscreen? Why is that important? How is that important? Because it depends on your skin type. For example, if your skin is dry, then that means you need little hydration. So using a cream based or a lotion based sunscreen would be great. If your skin is oily, if you have acne, then it would be great to use, a gel based sunscreen, something which is not oily. And if you've got combination skin, or, if your profession is such that, you have to attend a lot of meetings or be facing a lot of people every day, it's a great option to use mattifying sunscreens. So that is about the texture and the kind of sunscreen. Nowadays, you also have invisible sunscreens. You have fluid-based sunscreen. So there are so many different options. The second thing to keep in mind, so that is about the kind of sunscreen. Second thing is it also, this SPF matters. So SPF is the sun protection factor. So for people who just want to, those who don't have melasma, those who don't have pigmentation, even if they use something around 20 to 30 SPF, that is good enough. But once you have pigmentation or melasma or those kind of things, then it's ideal to use something between 30 to 50 SPF. So that is about the SPF, yeah. And other than that, on the labels, generally when we look at a sunscreen, there are a lot of details mentioned. So the other important factor is the PA, which is the protective factor against UVA, which is important. So it could be PA plus 3 to PA plus 4. If your sunscreen shows PA plus 3, that's more than enough. And the third thing is, yes, it should also, as I said, it should be broad spectrum. That's the third factor, which means it should not just protect us against UVA. If it has, additional things like infrared light, visible light, blue light, that would be good. That would add additional protection. So these are the few things that we need to keep in mind.
Right. You have already busted the myth that sunscreen does not just protect our skin from harmful sun rays. It also protects our skin from other harmful radiations, rays, etc. So it becomes very important for all of us, irrespective of our exposure under the sun, etc., to use sunscreen religiously, regularly. Now, whenever we talk about sunscreen, we are told that application, the amount of sunscreen we are using, the right way of application, reapplication, these all, play a vital role in how the sunscreen works. So, how to apply it, how many times to reapply, and how much to use.
Absolutely. So that's really important because sometimes, we end up picking up the right sunscreen, but then if you don't know how to use it correctly or the right quantity, it's still not going to do the job. It's not going to do what it's supposed to do. So as far as the face and the neck is concerned, it's the two fingertip rule, which means from the tip of the finger till the base of the finger, that is one fingertip. And then from this tip to this tip. So that is two fingertip units is what is recommended for the face and the neck, right? So two fingertip units once in 3 to 4 hours is good enough for the face. So that's about the quantity and the frequency. And for people, another important thing which we generally tell people is that, if you're stepping outdoors, it's ideal to apply it at least 30 minutes before you step out, because a sunscreen doesn't start working immediately. It doesn't start working the second you put it on, right? It takes some time. So 30 minutes before you step out, that is important. Because if you put it on 5 minutes just before you step out and you step out, you will still get tan, you will still get pigmentation, your melasma might still increase, it might not come under control. So the quantity is important, the frequency, by that we mean how many times we need to apply and when to apply, how much time before stepping out, that is also important.
Right. And how to do layering with sunscreen while using depigmentation treatment, doctor?
Yeah. So generally the sunscreen, we generally recommend sunscreens during the day. And what we tell the patient is to do is to, for example, initially when you apply your sunscreen, for some patients, they do find discomfort, or they feel that, when they put their sunscreen, they might be sweating, or, they might feel a white cast. So first of all, choose the right sunscreen. Coming back to that same point. So it's always good to use a sunscreen which blends in well with your skin. Like you can use mattifying products because, that doesn't leave a white cast or anything. So that would be a great idea. And after 3 hours, as you were saying, how to reapply and those kind of things, how to do layering. So what we tell the patient is after 3 hours, for example, if you are at home or if you have the chance to wash your face, you could wash it. It's not even necessary to use a face wash. You could just wash with water and reapply the sunscreen. In case you can't wash the face or anything, you could just take a tissue, just dab it on your skin, just so that, whatever residue is still there, that is removed. And in case that is also not possible, then you can just reapply the sunscreen, because nowadays there are lots of other options that are available. Like there are sunscreen sprays, you have sunscreen sticks also. So those things do not require, you don't need to remove the previous layer. After 3 hours, you can just reapply. So there are three things we can do. Either you can wash just with water, or if possible with face wash, that is fine. Second thing you can do is just dab and reapply with a tissue or with a wipe or something like that. And the third option is no need for dabbing, no need for cleansing, no nothing. You just need to reapply. And that is easier with the, the sprays or the sunscreen sticks. And also nowadays you have compact containing sunscreen. So that is also possible. So these three things are very easy for people who are on the go, continuously in meetings. That makes it very easy for them to layer.
Right. I'll take a few more questions from our viewers. Amin Sharif is here asking how to prevent melasma on forehead.
Okay, so the first thing to prevent is to put sunscreen, but not just on the forehead. It's very important to put the sunscreen, on the entire face, because once you get melasma on the forehead, there's nothing stopping the melasma from going on to other areas of the face.
Right.
So first of all, definitely put sunscreen, not just on the forehead, on the full face. Second thing you can do is, if it's particularly starting on the forehead, again, physical protection. As I said, caps, hats, shawls, some sort of a scarf, that would be a great thing, right? And then once in case, despite all your precautions and everything, in case melasma does come, then there are a lot of creams you can use, creams containing alpha-arbutin and, vitamin C and glycolic acid on the pigmented patches, on the melasma patches, that can be used.
Fair enough. Nandini Sharma is asking, my mother has pigmentation for quite long. Is it possible for her to get rid of it?
So, Nandini, the thing with melasma is that it's progressive, very gradually, but it generally progresses. What does it mean? That means that as we age, and, it generally has a tendency to increase if we don't keep it under control. So it's very, very important that once the melasma starts, then you need to be consistent with the skincare routine so that we can keep it under check. What we mean by that is we need to keep it under control. So we don't really say that melasma is curable, but melasma is definitely treatable. It's definitely controllable, and it's definitely preventable. So yes, the answer to your question, yes, it can be controlled, right? So as soon as it's always better to prevent it. So, for your mom, I would always say that for everyone, not just for your mom, for everyone, it's important to use a sunscreen. And once the melasma starts, then we should control it and keep it under check with external treatments, as I was mentioning, the ingredients prior. Yes.
Right. And that's why it's important to take advice from a qualified dermatologist. Kirti Kapoor is asking, are there any new or emerging treatments for melasma that are currently being researched or developed?
Yes, Kirti. So there are lots of new things in the pipeline. There are lots of new molecules. So there have been recently lots of ingredients like terovite, silymarin, all these kind of ingredients that are available as topical preparations. Even a lot of patients use tranexamic acid serums or creams and glutathione containing products. These are all antioxidants, right? Which also help for melasma. Then there are lots of oral antioxidants. Oral antioxidants means that what you can consume, and antioxidants means See, basically, oxidants are like the toxins in the skin, and antioxidants are, the molecules that actually prevent or they bind to the toxins and negate the effect of those harmful toxins on the skin. So, lots of antioxidants are available, which are newer molecules which help for melasma. Then, if you're talking about options other than just creams and oral treatments, yes, there are a lot of procedures which can be done. There are lasers, there are peels, there's so much that can be done for melasma nowadays, right? So, that's what it's very important that once you have melasma, I mean, of course, for procedures, you do need to go to a qualified dermatologist. I'm sure you will have, a dermatologist who or someone, where you're from. But definitely, meet your dermatologist, speak to them, and they would be the best person to tell you as to what treatment option. Will your melasma just come down with creams, or you need oral supplements, or whether you need to go for procedures?
Right. Pavan, maybe you give him a similar answer, but still I'm reading the question. Are there any particular ingredients that are especially effective for hyperpigmentation?
Yes. So, specific ingredients for melasma and hyperpigmentation, yes, there are lots of depigmenting agents. I'm sure most of us would have heard of hydroquinone, right? So, hydroquinone is a very good depigmenting agent, which is recommended for melasma, but it should not be used over the counter. I mean, that is my suggestion. A lot of people end up using it, but every medication has to be used for certain situations in certain patients, and everyone's skin is very different. So when you're using these more advanced treatment options, it's always, and see, these are medications, which means it should be prescribed by a qualified dermatologist. So yes, hydroquinone is a great option. Retinol is a great option. Glycolic acid is a great option. Tranexamic acid is a great option. Glutathione is a great option. But these are things which are readily available, but should not be readily used. It should be, I mean, meet your dermatologist. It doesn't take more than 5 minutes. Ask them, and or more than you asking them, they will suggest you. They will tell you, yes, use this, use this. Because when you do it in that way, right, you're going to be quite sure that you won't end up with side effects. Because what suits one person might not suit you, and what suits you might not suit another person. So that is important.
Right. And causes also vary. What may have caused melasma for you must be different from why other person is getting it. One more question from our viewer, Parul Shinde, asking, Doctor, can you please suggest a good treatment option for sunspots?
Okay, so sunspots in common terms are known as, I mean, that's the late term, but the medical terminology is freckles, or sometimes they are larger ones, which are called as seborrheic keratosis, right? So the treatment for freckles and sunspots in seborrheic keratosis is, of course, first and foremost, once you start getting them, it's not like I mean, the sunscreen is not going to help. The first thing, again, I know I'm repeating this again and again, but trust me, there's nothing more important than a sunscreen. You have to put a sunscreen. And the reason behind that, I'll tell you, Parul, because even if you use a cream to lighten the freckles or the sunspots, or if you do a treatment or you do a laser to remove it, the point is that the sun is always going to be there. It can always come back. So unless you don't use your sunscreen, there's no point of treating the sunspots. They'll keep going, and then new sunspots will keep coming. So number one, sunscreen. Number two, you can start using local applications to lighten the spots.
Okay. And doctor, before we sum up, would you like to tell us daily skincare routine with patient of melasma and hyperpigmentation?
Absolutely. So, see, anyone who has hyperpigmentation or is at the risk of hyperpigmentation or melasma, the daily routine, we should keep it as simple as possible, because
Right.
it's possible for everyone to do. So the first thing in your skincare routine would be to use a gentle cleanser, number one. So as soon as you cleanse your skin, the next step should be the moisturizer. Now, the moisturizer depends on your skin type. Like if you've got an oily skin, you could use a gel-based moisturizer. If you've got a dry skin, please use a cream-based or a lotion-based moisturizer. On top of the moisturizer, the next step is to put your sunscreen. Quantity, number of times, and the kind of sunscreen, very, very important. So make sure that you're using the right dose, the right quantity of sunscreen, and apply generously on the entire face and neck. And a lot of people end up forgetting other important areas like the ears, right? Ears, neck, these are very important. So I always, and the hairline, these areas. So make sure that you're putting the sunscreen, but apply it properly, right? So this is in the day, and then you reapply your sunscreen once in 3 to 4 hours. Now, coming to the evening or the night routine, again, you would cleanse, put your moisturizer, and then for someone who has pigmentation or melasma, you could use good ingredients like good serums containing vitamin C, retinols, glycolic acid, tranexamic acid. There are so many good products available. Meet your dermatologist. You don't even have to use too many products. Nowadays, there are so many good creams and serums which have all these ingredients together, right? So certain ingredients can be combined. Nowadays, you get molecules, you get products like kojic acid, niacinamide, glycolic acid, everything is combined together. So it doesn't have to be that difficult. You could just use one night cream and get the benefits of everything together. So that is also possible. So, but that's
Right.
the day and night routine, the skincare routine.
Thank you so very much, Dr. Gillian Roga. It was wonderful talking to you. Thank you so very much for your valuable time. The whole session was so informative, and we are really looking forward for many more such sessions with you for our viewers in the coming times. Thank you so very much.
Thank you so much. And it was my pleasure being here with you all.
Thank you, Doctor. And viewers, thank you for your active participation in today's session. And please stay connected to our beautiful Spotless Skin page. Thank you. Keep glowing. Take care. Goodbye.